Hi, I'm Dr. Nicole Vane of Moonlight Beach Dental, and on this episode of Holistic Dentistry Uncovered, I wanted to do a case study for you on safe mercury removal. Now, if you'd like to learn more about the safe mercury removal protocol that is also called SMART, as recommended by the Huggins Protocol or IOMT, feel free to check out some of our videos on what you should look for in a dentist that provides safe mercury removal. Now, on this patient, he wanted his mercury fillings out because he was concerned about the impact on his overall health as well as his fatigue and brain fog that he was having. I was concerned about that, but also, if you look, this mercury was starting to split the tooth. There's a lot of cracks on each side of the tooth, and these main chewing cusps are starting to turn black because the mercury is actually seeping inside of them. And that is going to cause the tooth eventually, if left untreated, to completely crumble or to split in half and need to be removed. So the mercury needs to be removed safely to protect the patient from swallowing it and inhaling it. But also we need to protect this tooth and make sure that he doesn't end up losing it. So how do we do that? Well, we invite the patient into the operatory and we drape them to protect them from having the mercury go everywhere. We have specialized suction devices that we use while we are removing the mercury, as well as mercury ionizers that are attached to each wall of the operatory. We have the patient connected to oxygen, so they're not inhaling any of the mercury vapors, and we also have rubber dam and other face drapes that go on top of the patient's face so that the mercury doesn't go onto their skin. Now, when we're removing it, we will either supplement the patient with antioxidants that are specific for mercury, like vitamin C and glutathione, through IV, which is best, or if the patient elects not to have the IV, then what we'll do is supplement them in the operatory after we've finished the removal to ensure that the mercury, if any escaped, is safely bound up and going to be excreted by the patient. So what we do is we have liposomal vitamin C, we have glutathione, and binding powder, as well as activated charcoal here in the operatories that we'll give you once we've finished with the procedure to make sure the patient is completely protected. Mercury removal does not have to be a scary process, but it is something that needs to be done safely and by a certified dentist who knows how to safely protect you from inhaling and swallowing all of the mercury. If you're interested in exploring mercury removal and you'd like a consult, feel free to come in at Moonlight Beach Dental.